So at some point you might feel I'm getting sick, and it's still a question mark. We don't have a pretty solid system yet because the testing is kind of inconsistent. So you might be kind of questioning yourself at home. I guess a first thing to think about is if you might be coming down with those initial symptoms, again, fever, shortness of breath, coughing, those common first signs, it's good to kind of sequester yourself, kind of occupy the sick room, and plan for some rest and some sleep. Again, we're kind of hearing some anecdotal stories of people feeling like they're having a loss of taste in their mouth. There's no scientific backing to that yet, so just know that kind of the tall tale signs again are the fever and the shortness of breath. One thing I forgot to mention before is there's been some questions in the news on what medications to take, which over-the-counters are okay to take. To be on the safe side, it seems pretty consistent to take acetaminophen or Tylenol product. There's been a couple studies that might kind of have some questionable methods and whether how solid they are about ibuprofen maybe kind of making the illness a little worse or not. If you're allergic to Tylenol, it's probably a good bet that you could take ibuprofen or another pain and anti-inflammatory medication, and you'll probably be just fine. But if you're not allergic to anything, to be on the safe side, Tylenol is it, and just follow the directions so you don't take too much or overdose on that as well. But sequester yourself, get in the isolation room. If you have access to binge TV watching, get that all ready to go, because you're going to be resting for the next few days until you like really clearly either have the symptoms of COVID or another respiratory illness, and are kind of ready to take the next steps. If you have housemates and they decide that they leave, they want to be around you, it's just good to know that they very well could already have caught the virus from you and already be contagious, so their leaving might not help the situation. It might be best just to have them stay, in the house as well. So if they fall ill, then hopefully people aren't sick at the same time, and you kind of care for one another. But an important tip and trick you should take note of is tracking everything at this point. Have a little journal that you're going to write down what your fevers are at what time. If your breathing changes and you feel like it's getting heavier and harder to breathe, write that down with a date and a time. Kind of the quality and the consistency, and if you're coughing stuff up, write those notes down, because if things were to get bad enough that you would need to go seek hospitalization, they're going to want to know a timeline of your illness for sure. And then I'm telling people to call your primary care clinic and provider, if you have one, to report your symptoms, just so they can kind of track and understand that they have patients that are sick at home. Again, if there's testing availability and that changes, or that the health system that you belong to is able to do testing, they might want to have you come in and get tested at this point, or they might just say it's good to know you're having symptoms, stay home, isolate yourself, and be sick there. But do know that testing at this point still requires a provider's order from either your physician, nurse practitioner, or physician's assistant. So don't go to get testing without that, because they're going to require it, especially if you're going to one of our kind of state or local testing stations that are out there. And again, at this point in the illness, it's pretty consistent that we don't want you to go to the hospital unless you're severely short of breath. That's at what point, that's the point that it's clearly an emergency, and like any emergency, you would dial 911 or get yourself to an emergency department as quick as you can. But just because you're showing symptoms, if they're not out of control, the best bet for you is to stay home and convalesce, and not go outside again of the protective barrier of your house, because there are certainly very, very ill people that are going to the hospital, and we want to make sure that beds are available for them, especially if they need ventilation. So stay at home.